One of the most common conditions we see in lower limb sports medicine is plantar fasciitis. We estimate in the UK that something like 1 in 10 will suffer at some point through their lifetime. It is primarily an overuse injury, so normally an injury caused by doing too much too soon before your body gets a chance to build up and strengthen to particular activity or load that you're placing upon it. Normally causes pain right in the center of the heel. Generally characterized by pain on first step in the morning. So you get out of bed, it hurts, put your heel down. That should ease as you start to walk around, and that can take 5 or 10 minutes. Often will then start hurting towards the end of a day or towards the end of a long walk. Throb once you take the weight off your feet and sit down, and then hurt again on first step once you get going. Generally it's kind of aching sort of pain, and we don't associate pins and needles and shooting pains and burning pains with the plantar fasciitis, and that can sometimes be a sign that it could be something else. Plantar fasciitis probably is overdiagnosed, and so you see a lot of general practitioners and other health professionals diagnosing almost everything on the bottom of the foot as a plantar fasciitis. Rarely does a plantar fasciitis hurt through the arch of your foot. It is 99% in the pad at the bottom of the heel. There are other plantar fascia injuries that can hurt you through the arch. They are not common, but include plantar fibroma or plantar fascia tears, and these are normally only diagnosed once we have had imaging. Normally ultrasound scans is gold standard, but they'll also show on an MRI. Normally heel spurs are not a particular concern. These are now thought to rarely cause any significant problems, and so x-rays for plantar heel pain is somewhat redundant. With modern imaging technology, we can now see which structures are inflamed, and once upon a time when we used to just have an x-ray, you see a heel spur, we now know that the inflammation isn't actually around the spur, and it's in a different layer of the foot altogether. Treatment-wise, there's quite a few treatments for it, starting with some relative rest. So if you're training for a marathon, you cut your miles down, some rehabilitation. Some people start with stretching, although recently has been shown that strengthening exercises have a greater benefit than old-fashioned stretching of your plantar fascia. There are adjuncts to that, like custom inserts, shockwave therapy, which has shown good efficacy for this. Injections are also something that can be used, and these injections could be of corticosteroids, and more recently have been platelet-rich plasma injections have shown some benefit. Changes in footwear, sometimes a heel raise will also help. So there's a lot that can be done surgically. Very few of these end up in the surgeon's hands, although a plantar fascia release, where they essentially cut the plantar fascia, is a last resort, and not many people get there. I would always say that the most important thing for the patient is to be doing their rehab, and to follow their professional's advice, and the vast majority should get better. We see a lot of these in clinic rumbling on for far too long, and maybe slightly misdiagnosed or mismanaged earlier. We have lots of options, and you shouldn't have to live in pain. If you have any comments, please leave them below. If you've liked what you've seen, like the video and subscribe.